The shocking truth, how common vitamins can be dangerous after 60. Vitamins are generally considered helpful, even life-saving. We take them daily without a second thought, especially after 60, when we're told our bodies need more support. But what if that very habit, something we do in the name of health, is silently increasing our risk of a stroke? It sounds unbelievable, but mounting evidence suggests that for older adults, certain common vitamins, when misused, overused, or taken without guidance, can actually do more harm than good. Yes, they can raise your stroke risk, and in some cases, it can happen overnight. The idea that something as simple as a vitamin could contribute to a medical emergency like a stroke is shocking to most people. After all, we associate supplements with health, vitality, and disease prevention. But in the senior population, where the body's metabolism slows, blood vessels become more fragile, and existing medications are more common, supplements interact differently. What works for a 30-year-old may be dangerous for someone in their 60s, 70s, or beyond. Take, for instance, fat-soluble vitamins like A, D, E, and K. These are stored in the body's tissues and aren't flushed out easily. In high doses, they can build up to toxic levels. Vitamin E, often hailed for its heart benefits, can thin the blood excessively when taken alongside anticoagulants like aspirin or warfarin, which many seniors are prescribed. The result? An elevated risk of hemorrhagic stroke, a type of stroke caused by bleeding in the brain. This type of stroke is especially deadly and can strike without warning. Vitamin A, another fat-soluble vitamin, has been linked to increased intracranial pressure and blood vessel instability in excessive doses. And then there's calcium. Yes, the same calcium recommended to prevent bone loss in older adults has been implicated in arterial calcification when taken in excess, hardening the arteries and leading to increased stroke risk. It's not just about individual vitamins either. Seniors often take multivitamins, fortified foods, and additional single supplements, stacking their intake far beyond the recommended daily allowance. Without realizing it, many people over 60 are ingesting mega doses of certain nutrients daily, putting themselves at risk. This video will open your eyes to the vitamins you thought were safe and how, when taken in the wrong way or in excess, they could become dangerous. We're not here to scare you, but to empower you. Knowledge is your greatest defense. Understanding how your body changes after 60 and how supplements interact with age, medications, and health conditions can mean the difference between living well and becoming another preventable statistic. In the sections that follow, we'll break down the most concerning vitamins one by one. You'll learn what the latest research shows, what your doctor may not be telling you, and how to protect yourself without abandoning your health goals. Because the truth is, after 60, what you don't know about vitamins can hurt you, and your brain might be the first to suffer. Let's begin. Vitamin E, when heart healthy, becomes heart risky. Vitamin E has long been touted as a hero for heart health. It's an antioxidant that helps fight free radicals and protect cells from oxidative damage. For decades, it's been promoted as a supplement to lower heart disease risk. But for people over 60, especially those taking certain medications or with pre-existing health conditions, too much of this good vitamin can become very dangerous and very quickly. The problem lies in how vitamin E affects blood clotting. This vitamin has natural blood-thinning properties. In small dietary amounts like what you get from seeds, nuts, and leafy greens, this is generally safe and beneficial. But high-dose supplements, which often contain 400 EURs or more per capsule, can excessively thin the blood. This becomes a serious issue for seniors already on anticoagulant medications like warfarin, Coumadin, aspirin, clopidogrel, or even fish oil supplements. The combination can lead to spontaneous internal bleeding, especially in the brain, a hemorrhagic stroke. Hemorrhagic strokes account for roughly 13% of all strokes, but are far more deadly than ischemic strokes. In seniors, the risk increases with age-related changes in blood vessel strength and slower healing capacity. Studies, including those from the American Heart Association, have shown that high doses of vitamin E, especially over 400 EURs per day, can increase the risk of hemorrhagic stroke by as much as 22%. That's not a small number, and it's something most supplement labels don't warn about. Adding to the concern is how vitamin E is often included in multivitamins, anti-aging formulas, or heart health supplements, so seniors may be taking it in multiple forms without realizing the cumulative effect. Unlike water-soluble vitamins that flush out, fat-soluble vitamin E stays in your system longer. The more you take, the more it builds up, and the harder it becomes to reverse its effects quickly. It's also important to note that vitamin E is not without merit. It does offer benefits to the cardiovascular system and immune function. But those benefits are best obtained from food sources: almonds, sunflower seeds, spinach, and avocado, where the vitamin is balanced with other nutrients and absorbed more naturally. Supplementation should only be considered when prescribed or monitored by a healthcare provider, especially if you're over 60. If you're experiencing unexplained bruising, nosebleeds, dizziness, or headaches, and you're taking a vitamin E supplement, it may be time to have a serious conversation with your doctor. These could be signs your blood is too thin. The bottom line? What's marketed as heart healthy may, in the wrong context, threaten the very organ it's supposed to protect, and your brain as well. Seniors need personalized, informed decisions, not generic health advice. And in the case of vitamin E, too much of a good thing really can be deadly. Vitamin A, the silent accumulator that affects blood vessels. Vitamin A is often praised for its benefits to vision, skin health, and immune function. We hear it's essential for night vision and plays a crucial role in repairing body tissues. However, what most people, especially seniors over 60, don't realize is that this powerful, fat-soluble vitamin can quietly build up in the body to dangerous levels, increasing the risk of serious vascular issues, including stroke. Unlike water-soluble vitamins that are excreted when consumed in excess, vitamin A is stored in the liver and fat tissue. Over time, even slightly exceeding the recommended daily intake can lead to accumulation. This buildup, known as hypervitaminosis A, can cause a cascade of problems. One of the most concerning for older adults is the impact on blood vessels. Excess vitamin A can contribute to increased intracranial pressure, leading to symptoms like headaches, blurred vision, dizziness, and most alarmingly, a higher risk of hemorrhagic stroke. Several studies have linked chronic high intake of vitamin A with vascular fragility. In older adults, where the elasticity of blood vessels is already compromised, this becomes especially dangerous. The vitamin may also negatively affect calcium regulation, contributing to arterial stiffness, a precursor to both heart attack and stroke. For those already at risk due to high blood pressure or cholesterol, taking high doses of vitamin A supplements can tip the balance toward a medical emergency. Many people consume vitamin A in the form of retinol, found in animal products and most synthetic supplements. While beta-carotene, found in plant sources like carrots and sweet potatoes, is generally considered safer because the body only converts it as needed, preformed vitamin A, retinol, is active immediately upon ingestion. It's this form that's more likely to build up in the body and cause toxicity. The recommended daily allowance, RDA, for vitamin A in adults over 60 is about 700 micrograms for women and 900 micrograms for men. Yet many supplements exceed this amount in a single dose, especially multivitamins or vision support formulas. When combined with dietary sources like liver, fortified milk, and eggs, seniors can easily surpass safe levels without realizing it. The symptoms of vitamin A toxicity aren't always immediate. They can include bone thinning, joint pain, liver damage, nausea, and changes in mental status. But when the brain is involved, such as increased intracranial pressure or bleeding, the outcome can be sudden and life-threatening. To reduce your stroke risk, avoid high-dose vitamin A supplements unless prescribed by a healthcare provider. Instead, focus on getting vitamin A through a balanced diet, rich in colorful vegetables, and low in preformed retinol. Be wary of multivitamins with excessive dosages, especially those marketed to seniors. In the effort to support your eyes and immune system, don't overlook the hidden risks. After 60, your body's ability to handle excesses diminishes, and vitamin A is one of the most dangerous vitamins to overdo. Calcium supplements, from bone health to stroke risk. For decades, calcium has been a cornerstone of bone health advice, especially for older adults. Doctors frequently recommend calcium supplements to help prevent osteoporosis and fractures, a common concern for those over 60. But what many seniors don't realize is that calcium, when taken in excess or in isolation, may quietly increase the risk of stroke by contributing to arterial calcification and blood clot formation. Yes, the same mineral trusted to protect your bones may also harden your arteries. Calcium plays an essential role in muscle function, nerve signaling, and bone strength. However, the body tightly regulates calcium levels in the blood, and when too much is consumed, particularly in supplement form, it can lead to deposits in the arteries. These calcified plaques not only reduce the flexibility of the arteries, but also increase the risk of high blood pressure and ischemic stroke, the type of stroke caused by a clot blocking blood flow to the brain. Research has shown that calcium from food sources does not pose the same risks as calcium from supplements. In fact, studies published in journals like JAMA and BMJ have found that people over 60 who take high-dose calcium supplements, more than 1,000 milligrams per day, are at increased risk of cardiovascular events, including stroke. These risks are compounded when calcium is taken without magnesium or vitamin K2, which help direct calcium into the bones where it belongs, rather than letting it build up in soft tissues and blood vessels. Another danger lies in the common practice of pairing calcium supplements with vitamin D. While vitamin D helps with calcium absorption, high doses of both can flood the bloodstream with calcium, creating an imbalance. This imbalance can promote calcification in arteries and contribute to blood clotting, especially problematic for seniors who may already be on medications for heart disease, hypertension, or high cholesterol. Seniors with kidney disease or reduced kidney function are particularly vulnerable. The kidneys help regulate calcium levels, and any decline in kidney performance can lead to excess calcium in the blood. This further amplifies the risk of arterial stiffness and vascular complications. So, what's the safe path forward? Experts suggest that seniors aim to get most of their calcium from dietary sources, such as leafy greens, low-fat dairy, almonds, and fortified plant-based milks. If supplements are necessary, they should be carefully balanced with magnesium, vitamin D3, and vitamin K2, and taken under medical supervision. It's also important to space out doses and avoid taking calcium alongside meals that are already calcium-rich to prevent overloading the system. The goal is strong bones and a healthy cardiovascular system, not a trade-off between the two. If you're over 60, talk to your doctor about whether you really need calcium supplements and how to take them safely if you do. In the pursuit of preventing broken bones, don't risk a broken brain. Knowledge is your best safeguard, and calcium, though essential, must be managed with care. Iron overload: why too much iron can damage arteries. Iron is vital for human health. It helps transport oxygen in the blood and supports metabolism and energy production. But when it comes to seniors over 60, more iron isn't always better. In fact, excess iron, especially from supplements, can be dangerously toxic, contributing to oxidative stress, inflammation, and even stroke. Unlike younger individuals, seniors often have lower iron requirements. Unless diagnosed with iron deficiency anemia, most older adults get sufficient iron through diet alone. Yet many multivitamins still contain iron, and some people take iron supplements out of habit, not realizing the damage it can cause. The body stores excess iron in organs and tissues, and with age, the natural ability to regulate iron absorption declines. This can lead to a condition known as iron overload or hemochromatosis. Excess iron acts like rust inside the body. It promotes the formation of free radicals, unstable molecules that damage cells and tissues. The walls of blood vessels are particularly vulnerable. Over time, oxidative stress weakens these vessel walls, leading to stiffness, thickening, and a greater chance of clot formation. That's where stroke risk comes in. Iron-fueled damage to the endothelial lining of arteries may lead to atherosclerosis, or hardening of the arteries, a key risk factor for ischemic stroke. More concerning, several studies have found associations between high ferritin levels, a marker of stored iron, and increased stroke incidence, particularly in men over 60. Ferritin may also rise with inflammation, creating a feedback loop that exacerbates vascular problems. And if you already have conditions like high blood pressure, diabetes, or elevated cholesterol, excess iron can multiply your stroke risk. Iron supplements can be particularly dangerous when taken with vitamin C, which enhances iron absorption. That combination, common in immune-boosting supplements, can lead to unintentional overload. Seniors taking iron for energy or fatigue without confirmed deficiency are putting themselves at serious risk. If you're experiencing fatigue, joint pain, liver discomfort, or bronze-tinted skin, these could be signs of excess iron. The only way to know for sure is through a blood test. Doctors can check serum ferritin and transferrin saturation to determine whether supplementation is necessary or harmful. The good news? Iron overload is preventable. If you're over 60, avoid iron-containing supplements unless your doctor confirms a deficiency. Be cautious with fortified foods and never self-prescribe iron for tiredness without testing. Folic acid and B vitamins. When more is not better. B vitamins are essential for energy, nerve function, and brain health. Among them, folic acid, vitamin B9, B6, and B12 are especially important for seniors over 60. They play a critical role in lowering homocysteine, a compound in the blood associated with heart disease and stroke. That's why many older adults are told to take B vitamin supplements. But what happens when these vitamins are taken in excess? Shockingly, the answer is increased stroke risk, particularly among seniors who are unknowingly oversupplementing. Let's start with folic acid. It's the synthetic form of folate found in fortified foods and most multivitamins. While folate from food is safe and beneficial, too much folic acid, especially from supplements, can accumulate in the bloodstream. This unmetabolized folic acid has been linked to nerve damage in older adults, especially those with low levels of vitamin B12. That's because excess folic acid can mask B12 deficiency, allowing neurological symptoms to worsen unnoticed. And guess what? B12 deficiency is common in adults over 60 due to decreased stomach acid production, which impairs B12 absorption. The result? Seniors might think they're protecting their heart with folic acid, while simultaneously increasing their stroke risk through hidden B12-related nerve and brain damage. The consequences can include confusion, memory loss, numbness in the hands and feet, and yes, higher stroke risk due to misfiring nerve pathways and poor vascular control. Vitamin B6 is another essential nutrient that turns dangerous in high doses. While necessary for brain development and immune support, long-term use of high-dose B6 supplements, usually above 100 milligrams daily, has been linked to nerve damage and poor coordination. Some studies suggest that excessive B6 intake can actually raise the risk of hemorrhagic stroke in older adults, possibly by weakening the integrity of small blood vessels. And then there's vitamin B12, vital for red blood cell formation and neurological health. Ironically, too little B12 can increase homocysteine, leading to higher stroke risk. But the solution isn't blindly taking supplements. Seniors must first confirm their B12 levels with a blood test. Supplementing unnecessarily or using synthetic versions that aren't well absorbed may not only be ineffective, but also interact with other medications. Together, these B vitamins create a balancing act. You need enough to support your brain and blood vessels, but not so much that you overload your system. The safest way to meet your needs is through a varied diet rich in leafy greens, beans, fish, eggs, and whole grains. Supplement only under the guidance of a healthcare provider who understands your complete medical history. The message is clear: more isn't always better. For seniors over 60, too much of a good thing, especially when it comes to folic acid and B vitamins, can quietly pave the way for a stroke. Monitor your intake, test regularly, and let your health decisions be informed, not accidental. Multivitamin dangers: the risk of stacking dosages. Multivitamins are one of the most popular supplements among adults over 60. They're marketed as convenient, all-in-one solutions to meet daily nutritional needs, especially for those concerned about age-related deficiencies. But what most seniors don't realize is that taking a multivitamin, especially alongside other supplements or fortified foods, can easily lead to vitamin overdoses. These stacked dosages can quietly accumulate in the body, increasing the risk of toxicity and even stroke. Multivitamins often include fat-soluble vitamins like A, D, E, and K, which aren't eliminated in urine like water-soluble vitamins. Instead, they're stored in the liver and fatty tissues, where they can reach dangerously high levels over time. A senior who takes a daily multivitamin, plus a calcium pill with added vitamin D, a separate vitamin E capsule, and eats fortified cereal for breakfast might unknowingly be consuming 3 to 4 times the recommended daily allowance of some nutrients. The consequences can be serious. Let's take vitamin E, for example. As we've already discussed, this vitamin has blood-thinning properties. In multivitamins, it's often included in doses of 100 to 400 IU. Add another heart health supplement or a standalone vitamin E pill, and you've got a recipe for excessive anticoagulation. For seniors on blood thinners, this is especially dangerous, heightening the risk of hemorrhagic stroke. Similarly, calcium combined with vitamin D, found in bone support multivitamins, can lead to arterial calcification when taken in excess. Vitamin A is another culprit. While essential for vision and immunity, excessive vitamin A from supplements, not food, has been linked to increased stroke risk, liver toxicity, and bone fractures. Multivitamins for seniors often contain both perform vitamin A, retinol, and beta-carotene, and the combined intake may be too much, particularly for women. Another issue is redundancy. A senior might take a multivitamin in the morning, a B-complex in the afternoon, and a magnesium supplement before bed. On paper, each product may look safe, but together they may deliver double or triple the recommended doses. The body doesn't always sound the alarm until symptoms like dizziness, fatigue, nausea, or elevated blood pressure appear. By then, the damage may already be underway. And let's not forget interactions. Some vitamins interfere with medications commonly prescribed to seniors. Vitamin K, for example, affects blood clotting and can counteract blood thinners like warfarin. If you're taking both a multivitamin and a blood thinner without guidance, you may inadvertently be undermining your treatment or raising your stroke risk. To stay safe, seniors should treat multivitamins as medications, not harmless add-ons. Always read labels closely, avoid duplicate ingredients across products, and consult with a healthcare provider before adding new supplements to your routine. It's also wise to bring your full list of vitamins and medications to your doctor or pharmacist for review. While multivitamins promise convenience and coverage, they may be giving you more than you bargained for. For adults over 60, the risk of stacking dosages is real, and the cost may be your brain health. Less may truly be more when it comes to supplements. Vitamin D excess. Why more sunshine isn't always better. Vitamin D is essential for bone health, immune support, and reducing inflammation. It's often called the sunshine vitamin because the body produces it when exposed to sunlight. As we age, natural production declines, and many seniors turn to supplements to maintain healthy levels. But here's what most people don't know. Excessive vitamin D intake, especially from supplements, can backfire, increasing the risk of stroke in adults over 60. Unlike vitamin D made through sun exposure or obtained from food, vitamin D from supplements can quickly accumulate in the bloodstream. Vitamin D is fat-soluble, meaning the body stores excess amounts in fat tissues. Over time, these reserves build up, and excessive vitamin D can lead to a condition called hypercalcemia, elevated calcium levels in the blood. This might not sound alarming, but elevated calcium can have serious consequences for vascular health. High blood calcium levels can cause calcification of soft tissues, including arteries. This process hardens and narrows the arteries, making it more difficult for blood to flow efficiently. The result? Increased blood pressure and a higher likelihood of stroke, especially ischemic stroke caused by blocked arteries. Studies published in the American Journal of Clinical Nutrition and the British Medical Journal have linked high vitamin D intake, particularly over 4,000 RERU daily, to a greater risk of cardiovascular complications, including stroke. What makes this more dangerous is that many seniors take vitamin D in high doses without regular monitoring. It's common to find supplements with 2,000 to 5,000 RERs per capsule, and sometimes more in megadose prescriptions. When taken daily over time, these levels can quietly cause harm without any immediate symptoms. Seniors taking calcium supplements alongside vitamin D are at even greater risk, as the two work synergistically to increase blood calcium levels. Signs of vitamin D toxicity include nausea, vomiting, confusion, muscle weakness, and frequent urination. In older adults, these symptoms are often mistaken for other health issues, delaying proper diagnosis. If untreated, chronic hypercalcemia can lead to kidney stones, kidney failure, and vascular damage, setting the stage for stroke and other serious health events. To avoid these risks, seniors should have their vitamin D levels tested regularly, especially if taking supplements. The ideal blood level is usually between 30 and 50 nanograms per ml, and doses should be adjusted accordingly. Most people over 60 only need 800 to 1,000 RERU daily, unless prescribed otherwise by a physician. The safest sources of vitamin D include moderate sun exposure in foods like fatty fish, salmon, sardines, fortified dairy or plant milks, and eggs. Supplementation should be personalized, not one size fits all. Vitamin D has earned its reputation as a vital nutrient, but it's not without risk. For seniors, especially those managing other chronic conditions, striking the right balance is critical. Too little and bones suffer. Too much and arteries may harden. The goal is smart, measured intake, supported by testing and medical guidance. Hidden vitamin K interactions, a stroke risk in disguise. Vitamin K rarely makes headlines, but its role in stroke prevention and overall vascular health is surprisingly important, especially for people over 60. Known for helping blood clot properly and keeping bones strong, vitamin K is often overlooked when evaluating the safety of supplement regimens. But seniors who take blood thinners or multivitamins need to be particularly cautious. Why? Because an imbalance in vitamin K, either too much or too little, can significantly raise the risk of both bleeding and clot-related strokes. Vitamin K comes in two main forms: K1, found in leafy greens, and K2, found in fermented foods and animal products. K1 helps your blood clot, while K2 supports calcium distribution, keeping it in bones and out of arteries. This balance is crucial. However, when seniors take blood-thinning medications such as warfarin, Coumadin, any sudden change in vitamin K levels can destabilize their treatment. Too little vitamin K can lead to uncontrolled bleeding, while too much can cause clot formation, potentially triggering an ischemic stroke. The danger escalates when seniors unknowingly consume supplements that alter vitamin K intake. Multivitamins, bone health complexes, and even anti-aging supplements sometimes include vitamin K without clearly labeling how much. If you're taking anticoagulants and suddenly boost your K intake, even through a new diet, it can interfere with your medication's effectiveness and lead to dangerous swings in blood clotting. On the other hand, avoiding vitamin K altogether isn't safe either. Emerging research shows that vitamin K2, in particular, helps prevent arterial calcification by directing calcium away from the arteries. Seniors who are deficient in K2 may experience hardened arteries, which increase blood pressure and the risk of stroke. This means that both extremes, too little or too much, pose significant threats. Compounding this issue is the fact that many seniors don't know their vitamin K status, and doctors don't always monitor it unless the patient is on warfarin. Symptoms of imbalance can be subtle: unexplained bruising, excessive bleeding, or blood pressure changes. Because vitamin K interacts with many medications, including cholesterol drugs and antibiotics, even short-term changes in your routine can create long-term risks. The best way to manage vitamin K safely is consistency. If you're on blood thinners, eat a stable amount of vitamin K-rich foods each week, like spinach, kale, and broccoli, and consult your doctor before adding supplements. If you're not on anticoagulants but concerned about stroke, talk to your healthcare provider about testing and the possible benefits of K2 for vascular protection. Seniors over 60 should not underestimate this quiet vitamin. Hidden in your multivitamin or your salad bowl, vitamin K plays a pivotal role in stroke prevention. Understanding its interactions and maintaining balance can mean the difference between protection and danger. Supplement safety tips: how to avoid stroke risk after 60. Supplements can be powerful tools for maintaining health, especially as we age. But for seniors over 60, the very pills meant to support vitality can sometimes create silent, serious risks, particularly when it comes to stroke. Fortunately, by following a few key supplement safety tips, You can avoid these dangers and make better, more informed choices. First and foremost, know what you're taking. This may sound obvious, but many older adults take multiple supplements without tracking their ingredients. A calcium pill here, a multivitamin there, an energy boost supplement from the store. All of these may overlap in ingredients like vitamin D, iron, or vitamin E. When taken in combination, they can quickly exceed recommended doses, particularly for fat-soluble vitamins that build up in the body and may lead to blood clots or hemorrhagic strokes. One of the most common mistakes seniors make is assuming that natural means safe. But natural doesn't mean risk-free. For example, ginkgo biloba, often taken for memory, can thin the blood and increase the risk of bleeding when combined with aspirin or blood thinners. St. John's wort can interact dangerously with prescription medications, including those for blood pressure and cholesterol. Always check with a doctor or pharmacist before adding a new supplement to your routine. Timing and dosage also matter. Some vitamins, like B12 or vitamin C, are water-soluble and generally safe at higher levels because excess amounts are excreted. Others, like vitamin A or D, can accumulate and cause toxicity over time. Taking high-dose supplements without regular testing can lead to silent health problems that surface only after significant damage has occurred. To avoid stroke risk, seniors should have their blood levels tested periodically, especially for nutrients commonly associated with cardiovascular health: vitamin D, calcium, folate, and iron. This allows your healthcare provider to tailor supplement advice to your specific needs, avoiding one-size-fits-all recommendations. Another tip: avoid megadoses. Just because a label says immune support or heart healthy doesn't mean more is better. Stick to moderate doses that align with official guidelines unless advised otherwise by your physician. If you eat a balanced diet, you may not need a supplement at all. Lastly, always bring a full list of your supplements and medications to your doctor. Many seniors see multiple providers who may not be aware of overlapping prescriptions and vitamins. A pharmacist can help you spot interactions and duplications that could spell trouble. When it comes to supplements after 60, safety isn't just about what you take. It's about how, when, and why. Careful planning and medical supervision can help you harness the benefits of supplements without increasing your risk of stroke. Over-the-counter supplements with hidden blood thinners. Many seniors over 60 take over-the-counter OTC supplements for general wellness without thinking twice. These products are widely available, often marketed as natural, and are assumed to be harmless. But buried in these seemingly benign pills are ingredients that act as hidden blood thinners, posing a serious risk for bleeding and stroke, especially when combined with prescription medications. One of the most common examples is fish oil. Omega-3 fatty acids, primarily found in fish oil capsules, are praised for their heart health benefits. But they also have anticoagulant properties, meaning they thin the blood. For seniors already taking aspirin, warfarin, or other blood-thinning medications, adding fish oil can amplify these effects and increase the risk of hemorrhagic stroke, a type of stroke caused by bleeding in the brain. Garlic supplements are another culprit. While garlic is a popular natural remedy for cholesterol and blood pressure, high doses of garlic in pill form can also act as a blood thinner. Combined with anticoagulant drugs, this can lead to nosebleeds, bruising, and potentially dangerous internal bleeding. The same applies to ginger and turmeric, often taken for their anti-inflammatory effects. Then there's vitamin E, frequently added to skin, nail, and hair supplements. Even at modest doses, vitamin E can inhibit platelet aggregation, reducing the blood's ability to clot. Taken alone, it may not be a major concern, but in combination with other blood thinners, it becomes a real risk factor for hemorrhagic stroke. Green tea extract, often found in weight loss and energy-boosting formulas, also contains compounds that can interfere with clotting. And don't overlook lesser-known herbs like dong quai, feverfew, and ginseng, all of which are found in OTC products and have anticoagulant properties. One of the biggest problems is lack of labeling transparency. Supplement manufacturers are not required to highlight interactions or cumulative effects. Seniors often have no idea they're taking multiple blood thinners at once, leading to a gradual buildup of risk. Another concern is that many seniors turn to these supplements for common issues: joint pain, memory loss, fatigue. without consulting a doctor. This DIY approach to supplementation may seem empowering, but it can be dangerous without proper medical oversight. To protect yourself, always read labels and look for ingredients known to affect blood clotting. Bring your entire supplement list, OTC and prescription, to your next doctor's visit. Ask specifically about interactions and whether your routine puts you at risk for stroke. Just because a supplement is available without a prescription doesn't mean it's safe. In fact, these hidden blood thinners could be silently increasing your stroke risk every day. For adults over 60, supplement safety is not optional. It's a matter of life and health. How fortified foods can lead to vitamin overload. Fortified foods are everywhere: breakfast cereals, plant-based milks, juices, breads, and even snack bars. They're marketed as healthier versions of common products, often boasting added vitamins and minerals for your heart, for strong bones, or for immune support. For seniors over 60, these fortified foods may seem like a convenient way to meet daily nutritional needs. But there's a hidden danger: vitamin overload, a condition that can quietly increase the risk of stroke, especially when combined with supplements and medications. Unlike natural food sources, fortified foods are engineered to contain extra nutrients. On their own, they're usually not dangerous. The problem arises when they're consumed in addition to multivitamins, supplements, or medications, pushing vitamin intake beyond safe limits. Most older adults aren't tracking how much they're getting of nutrients like folic acid, vitamin D, calcium, or vitamin E, and that's where trouble begins. Let's take folic acid, for example. It's added to cereals and flour products to prevent birth defects, but for seniors, too much folic acid can mask vitamin B12 deficiency. This hidden deficiency is linked to nerve damage, cognitive decline, and an increased risk of ischemic stroke. If a senior is eating fortified cereal in the morning, taking a multivitamin at lunch, and eating enriched bread at dinner, their folic acid levels can rise beyond the tolerable upper limit without them realizing it. Vitamin D is another common additive, especially in dairy alternatives like almond or soy milk. When consumed with high-dose vitamin D supplements, fortified foods can push blood levels into the toxic range. This leads to hypercalcemia, excess calcium in the blood, which has been associated with vascular calcification, one of the major contributors to stroke in older adults. Calcium itself is also frequently added to orange juice, breakfast bars, and other packaged goods. Seniors who already take calcium supplements for osteoporosis may inadvertently consume more than they need, increasing the risk of arterial stiffness and poor circulation. Recent studies have found a link between calcium overload and both heart attack and stroke, especially in individuals over 60. Even iron, another common fortification, can become harmful in excess. Postmenopausal women and older men do not lose iron regularly through menstruation, meaning they require much less of it. High iron intake can lead to oxidative stress and inflammation, two key drivers of vascular damage. What's most concerning is that nutrition labels can be misleading. A food may say it provides 100% of your daily need for a vitamin, but that's for young adults, not seniors. Furthermore, those numbers don't account for the supplements you might be taking, leading to chronic overconsumption. To reduce the risk of stroke, seniors should treat fortified foods with the same caution as supplements. Track nutrient intake from all sources. Ask your doctor whether you need specific fortified products or if they're adding unnecessary risk. Blood testing can reveal if you're getting too much of certain vitamins and minerals, allowing you to adjust your diet and supplement routine accordingly. Remember, more isn't always better. Especially after 60, smart nutrition means balancing, not overloading. Medications plus supplements, deadly combinations for seniors. For adults over 60, it's not uncommon to have a shelf full of prescription medications and another filled with over-the-counter supplements. Both can offer important health benefits, but when taken together without proper oversight, they may create deadly combinations that drastically increase the risk of stroke. As we age, our bodies process medications and nutrients differently. The liver and kidneys, responsible for breaking down and eliminating drugs, don't function as efficiently, and this can make seniors more vulnerable to interactions. What's especially concerning is that many supplements interfere with medications that directly affect stroke risk. blood thinners, blood pressure medications, diuretics, and cholesterol-lowering drugs. One of the most dangerous combinations is blood thinners and vitamin E. Vitamin E is common in multivitamins and supplements marketed for skin, hair, and heart health. But when paired with warfarin, aspirin, or even fish oil, it increases bleeding risk, raising the chance of hemorrhagic stroke. The same is true for ginkgo biloba, garlic capsules, and turmeric supplements. Another serious risk comes from calcium supplements combined with certain heart medications, like calcium channel blockers. Seniors often take calcium to support bone health, but excessive intake can blunt the effectiveness of these drugs or lead to high calcium levels in the blood, hypercalcemia, which has been linked to stroke and heart attack. St. John's wort, a common herbal remedy for depression, can severely interact with dozens of medications, including blood pressure meds, statins, and antidepressants. It accelerates how quickly the liver breaks down certain drugs, reducing their effectiveness. For a senior managing high blood pressure or atrial fibrillation, reduced drug potency can increase stroke risk dramatically. Iron supplements, too, can be risky when mixed with medications for thyroid disease or Parkinson's. Iron blocks the absorption of levothyroxine and carbidopa-levodopa, potentially leaving conditions poorly managed. Iron also contributes to oxidative stress when taken in excess, which is a contributor to vascular inflammation. What makes these risks so insidious is that many doctors don't know all the supplements their patients are taking, because seniors often don't report them. This isn't always intentional. People may think vitamins are harmless, or they may forget to mention products picked up at the pharmacy or health store. But this missing information can lead to dangerous oversights. To stay safe, always carry an updated list of every supplement, vitamin, herb, and prescription you take, and share it with every healthcare provider you see. Pharmacists are also valuable allies. They're trained to identify drug-supplement interactions and can alert you before a problem arises. Regular lab tests also help. If your doctor is aware of everything you're taking, they can better monitor your nutrient levels, liver function, and cardiovascular health, catching warning signs before they escalate. After 60, health management is a balancing act. Supplements can support wellness, but only when carefully coordinated with your medications. Without that harmony, what starts as a healthy habit could end in a life-threatening stroke. What your lab results might be hiding. You go in for your routine checkup. The nurse draws blood, and a few days later your doctor says, "Everything looks fine." You breathe a sigh of relief and go on with your day. But for seniors over 60, that single sentence can be misleading, especially if you're taking vitamins or supplements. Because the truth is, your lab results might be hiding serious warning signs, including increased risk for stroke. How is this possible? For starters, most standard blood tests don't measure all vitamin or mineral levels, and doctors often don't request these labs unless there's a known deficiency or obvious symptom. While you might get results for cholesterol, glucose, or kidney function, rarely will you see your vitamin D, B12, folic acid, magnesium, or homocysteine levels unless you specifically ask. Why does this matter? Because certain nutrients, when either too high or too low, can silently raise your risk of stroke. Take vitamin B12. A deficiency in B12 can increase homocysteine levels, an amino acid linked to damaged blood vessels and clot formation. High homocysteine is one of the lesser-known stroke risk factors, yet it's easily reversed with proper supplementation. But without testing, you may never know you're at risk. On the flip side, excess vitamin D or calcium, often from oversupplementation, may go unnoticed unless you're checking your blood calcium levels. Elevated calcium can lead to arterial stiffness, high blood pressure, and calcified arteries, all of which raise the chance of an ischemic stroke. If you're taking calcium supplements and consuming fortified foods, your levels may be dangerously high without any symptoms at all. Iron is another hidden hazard. Seniors, especially postmenopausal women and men, rarely need extra iron unless there's anemia, yet many multivitamins include it. Excess iron can build up in the body and promote oxidative stress, damaging blood vessels in the brain. Unfortunately, standard lab panels often don't include ferritin or transferrin saturation, key markers of iron overload. Then there's the issue of drug-nutrient interactions. For example, certain medications may deplete nutrients like magnesium or potassium, which affect heart rhythm and vascular tone. If your doctor isn't monitoring these levels, the combination of drug-induced depletion and supplement-related imbalance can create the perfect storm for a stroke. Even liver and kidney function labs can offer hidden clues. If you're unknowingly taking a supplement that stresses your liver, like high-dose vitamin A, niacin, or green tea extract, those slight lab abnormalities could be the early sign of toxicity. But unless your provider connects the dots, it might go ignored. The bottom line? Ask questions. Request comprehensive panels that include vitamins, minerals, and markers like homocysteine or C-reactive protein. These can reveal hidden risks and help your doctor make informed decisions about what you should or shouldn't be taking. Your blood work may look normal on the surface, but if you're over 60 and using supplements, what's hiding in the fine print could be the key to preventing a stroke. Don't settle for vague reassurances. Dig deeper and protect yourself with knowledge. Safe supplementing guidelines for seniors over 60. By the time you reach 60, taking vitamins and supplements can feel like second nature. You may have heard from friends, seen advice online, or simply followed your doctor's past guidance. But with age comes increased sensitivity to how your body processes nutrients, and that means supplementing safely is no longer optional. It's essential, especially when your goal is to avoid serious health risks like stroke. So how can you reap the benefits of supplements without crossing into dangerous territory? Here are clear, evidence-based guidelines tailored for seniors over 60. 1. Always start with blood work. Before beginning any new vitamin or mineral regimen, ask your doctor for comprehensive blood tests. This should include vitamin D, B12, folate, calcium, iron, and homocysteine levels. These give you a snapshot of what your body actually needs and what it already has in abundance. Supplementing without testing is like filling a glass that may already be full, or worse, overflowing. 2. Avoid megadoses. Many seniors assume that more is better, especially when it comes to immunity, energy, or bone health. But excessive intake of fat-soluble vitamins, A, D, E, K, can build up in the body and become toxic. For example, taking high-dose vitamin E along with a blood thinner can significantly increase stroke risk. Stick to supplements that provide 100% or less of the recommended daily allowance unless your doctor advises otherwise. 3. Check all sources of nutrients. Are you taking a multivitamin plus fortified cereal plus a protein shake with added vitamins? It's easier than you think to stack nutrients unknowingly. Keep a log of all products you consume daily, food and supplements alike, and tally the totals for vitamins like D, B6, and iron. Seniors can quickly reach dangerous levels when they're getting nutrients from multiple directions. 4. Watch for interactions with medications. Blood pressure meds, anticoagulants, cholesterol drugs, and diabetes medications can all interact with supplements, sometimes in life-threatening ways. For instance, calcium can interfere with thyroid medication, and St. John's wort can render blood thinners ineffective. Before starting anything new, run it by your pharmacist or healthcare provider. They can flag potential red flags you might not notice on a label. 5. Avoid trendy supplements not backed by research. Products like brain boosters, anti-aging formulas, or detox capsules often contain unregulated ingredients. These may not only be ineffective, they can spike blood pressure, thin the blood, or cause liver stress. Seniors should avoid supplements promising quick fixes or miracle cures. Stick with nutrients that are backed by decades of research. 6. Simplify your supplement routine. Instead of juggling 5 or 6 bottles, streamline your regimen. Focus on only what your body needs, based on your health status, lab results, and age. A well-chosen multivitamin and targeted nutrients like D3 or B12 may be more than enough. 7. Schedule an annual supplement review. Bring all your pills, powders, and tablets, prescription or not, to your doctor or pharmacist at least once a year. This check-in ensures your supplement routine is still appropriate for your health status and doesn't put you at unnecessary risk. Remember, supplements can enhance your health, but they can also harm you if taken blindly. With a smart, personalized, and cautious approach, You can stay strong, sharp, and stroke-free well into your golden years. Conclusion: protecting your brain, your body, and your future. As we've seen throughout this video, the world of vitamins and supplements is far more complex and potentially dangerous than most seniors realize. What was once a simple act of taking a multivitamin with breakfast can become a silent threat when not properly managed. And for those of us over 60, the consequences of a misstep can be severe, even life-altering. Stroke is one of the most devastating health emergencies a senior can face. It strikes quickly, often without warning, and leaves a trail of damage that can affect speech, memory, mobility, and independence. The terrifying truth is that some of the most common vitamins and supplements, ones we've trusted for years, can quietly raise the risk of this life-changing event. But this isn't a message of fear, it's a wake-up call and a call to empowerment. The good news is that, armed with the right knowledge, you can protect yourself. You've learned about which vitamins, like E, D, and K, can cause complications when taken in excess or with certain medications. You've uncovered how fortified foods, herbal remedies, and even over-the-counter pills might be stacking nutrients in your system without your knowledge. And most importantly, you've seen the essential role that proper lab testing, medication reviews, and smart dosing play in creating a safe, effective supplement routine. You don't have to throw away every bottle in your cabinet, but you do need to treat supplements with the same care and respect as prescription medications. That means checking labels, asking questions, getting tested, and speaking up, because your doctor may not know what you're taking unless you tell them. If there's one takeaway to carry with you, it's this: natural does not always mean safe, and more is not always better. What your body needs at 30 is very different from what it needs at 60, 70, or 80. Your metabolism, absorption rates, and medication sensitivities have all changed. So should your supplement habits. Every stroke prevented is a life preserved. Every smart decision today is a step toward a stronger, more independent tomorrow. You deserve to move through the world with confidence, not fear. And you deserve health guidance that's grounded in science, not hype. So now it's time to take action. Go through your supplement drawer, make a list, book that appointment, bring your full health story, supplements included, to your doctor, and ask, am I doing this safely? Because your life, your brain, your independence, they're worth protecting. And if this video opened your eyes or gave you tools you didn't have before, don't keep it to yourself. Share it with a friend, a spouse, a sibling. You might just save a life. Like, share, subscribe to Senior Health Tips for more in-depth guidance on aging well, staying strong, and protecting your future, one decision at a time. Thank you for watching. Stay safe, stay smart, stay strong.